Hello, my name's Elaine Golden, and I'm the Social Justice and Advocacy Consultant for the Diocese of Toronto. Today, I'm joined by some of the members of our Diocesan Social Justice and Advocacy Committee and our Poverty Reduction Subcommittee as we discuss some of the questions around this year's Social Justice Vestry motion, protecting and expanding harm reduction in Ontario. Although opioid overdoses claim the lives of 7 people in Ontario every day, the provincial government has passed legislation that will close at least 10 supervised consumption sites in the province, including 5 in our diocese, and prohibits future sites from opening. We are concerned about the impacts of these closures, not only on the people they serve, but also on the wider community. This year's Vestry motion calls on the government to reverse the closure of these sites and to lift the ban on the creation of new sites in order to extend life-saving harm reduction to Ontarians. You can find this motion and related resources on our diocesan website at www.toronto.anglican.ca/vestry-motion. I'm grateful for the Reverend Canon Maggie Helwig, the Reverend Canon Andrea Budgie, the Reverend Deacon Michael Van Dusen, Miss Lisa Luciani Turner, and Mr. John Sprague, who are joining me on today's video. My first question is for Canon Andrea. Supervised consumption sites have been described by some as drug dens. Can you explain what a supervised consumption is and what happens there?
Thanks, Elaine. There are a lot of popular misconceptions about this. One thing that supervised consumption sites do not do is supply illegal drugs. They're places where people who use drugs can bring the drugs that they've obtained somewhere else and use them under the supervision of staff who are trained to respond immediately to any adverse reaction. The sites do provide sterile equipment, including needle exchange, which helps to prevent the transmission of HIV and hepatitis C, other bloodborne diseases and infections. Some sites also offer testing of drugs that people bring in to see if they contain toxic or otherwise unexpected substances like fentanyl. And given the increasing toxicity of street drugs now, this is an important way to help prevent overdose death. Supervised consumption sites are first and foremost healthcare centers. Along with supervised consumption and needle exchange, they offer primary health care, including wound care, diabetes management, women's health care, and vaccination. This is especially important as many drug users tend not to seek health care for fear of the stigma that they experience when they do that. The sites also help to connect people to other supports, including addictions treatment, housing, and mental health supports. Many of them provide meals and snacks, water, a quiet space for people to rest or to engage in various forms of therapy. The sites foster a sense of trust, acceptance, and belonging for people whose lives have been marked by the opposite.
Thank you, Andrea. My next question is for Lisa. Isn't providing supervised consumption sites and harm reduction services just enabling drug users? Shouldn't we be getting people into treatment instead?
Thanks, Elaine. There is no contradiction between harm reduction and seeking treatment for substance abuse. People who use drugs are not always in a position to seek, much less achieve, abstinence from drug use. Nor is recovery from substance use a linear process. People have relapses and fluctuating motivation for giving up drugs, just as most of us do with more socially acceptable vices. Providing safe, supervised consumption sites recognizes that some people are going to use and strives to minimize the harms of that drug use to both personal and public health. By keeping people alive and providing a safe, stigma-free space, not only to use drugs, but to access other supports, Safe consumption sites help people get to a place where they can choose recovery, or at least reduce their drug use and other risky behaviors. Statistics show that people who regularly use supervised consumption sites are nearly twice as likely to enroll in addiction treatment. Harm reduction and access to treatment thus go hand in hand as part of a full continuum of care. Even when people seek treatment for their addictions, there are insufficient treatment resources to meet the demand. The cost of private treatment is far above what people on low incomes are able to pay, while publicly funded detox and treatment beds are difficult to access. Between April 1st, 2023 and March 31st, 2024, staff at the Moss Park site made 55 detox referral calls for clients, but beds were only available for 2 of those times. The government's policy announcement promised funding for 500 new treatment beds, but this would still not be enough to meet the demands of 75,000 unique clients served by the sites to be closed in Ontario. Sadly, many users will die before they can access treatment.
Thanks, Lisa. My next question is for Ken and Maggie Helwig. This legislation specifically targets supervised consumption sites within 200 meters of schools, daycares, and early on centers. Don't these sites make neighborhoods unsafe?
Yeah, neighborhood safety is a really understandable concern. The sites are necessarily located in areas of need and deprivation, and it's very easy to confuse underlying conditions with the effect of the sites. But we have a lot of solid data which does not support the contention that supervised consumption sites lead to more crime. An analysis of 13 years of homicide data in Toronto shows that homicide rates actually showed a small but significant decline in neighborhoods near supervised consumption sites after the sites opened, while areas further away from the sites showed a small but significant increase. Similarly, analysis of 9 years of data from the Toronto Police Service showed significant decrease in assaults and robberies in neighborhoods with sites after the sites opened, while neighborhoods without sites didn't show such a decline. In addition, and this is possibly what's of the greatest concern to a lot of parents, studies show that supervised consumption sites lead to a 50% reduction in public injecting for people who are homeless or precariously housed. So I think that, in fact, what the data is showing us, what the evidence is showing us, is that it is the closure of the sites which is going to make neighborhoods unsafe.
Thank you, Maggie. My next question is for Deacon Michael. Does closing these sites make sense according to the evidence? Is it cost effective?
No. In fact, the government has repeatedly ignored the recommendations of taxpayer-funded reports and reviews, including those the government itself has commissioned. In October 2018, the province moved to restrict the number of supervised consumption sites and the amount of funding for them, inconsistent with a September 2018 summary of evidence and expert consultations by its own Ministry of Health and Long-Term Care. That summary concluded supervised consumption services were effective against overdose mortality, improved uptake of addiction treatment, reduced public drug use, and they were cost-effective, among other benefits. It also ignored the recommendations of the province's Opioid Emergency Task Force to support supervised consumption sites, along with increased access to addiction treatments. Despite expressing a commitment to expanding access to treatment, provincial spending on mental health and addictions actually decreased for the 2 years starting in 2018. then remains static for the next 3 years. After a shooting near the South Riverdale Community Health Center in 2023, the province commissioned 2 expert reviews, whose reports were released last year. Neither of these reports recommended closure, but rather called for increased funding, both to address community safety needs and to expand harm reduction services, recognizing a clear need for the services. Paramedics, emergency physicians, the Registered Nurses Association of Ontario, and Toronto's Acting Medical Officer of Health have all noted that closing safe consumption sites will result in an increased burden on emergency medical services, including longer wait times for ambulances and in emergency rooms, which will negatively impact other vulnerable Ontarians, including seniors. Another thing to be concerned about is the way this legislation was fast-tracked to limit debate and public consultation. The bill went from second reading vote to third reading vote on the same day, December 2nd, 2024, without being referred to committee for public consultation and all-party review. The next day, December 3rd, 2024, the Auditor General of Ontario released a report criticizing the government for its outdated opioid strategy and for failing to develop a comprehensive plan to assess, quantify, or mitigate the impacts of closing safe consumption sites on public health and Ontario healthcare system.
Thank you, Michael. My last question is for John. Our diocese, as we all know, is much bigger than the City of Toronto. What would you say to people who would say this is a Toronto problem and not one that affects the whole diocese?
Substance use is not a Toronto or a big city problem. Communities all across our diocese are seeing increases in substance use. The sudden deaths, particularly of young people from opioid overdose, devastate families. This epidemic touches everyone, and communities everywhere can benefit from enhanced access to harm reduction. It is true that of the 10 supervised consumption sites slated to be closed due to their location, the 5 within our diocesan boundaries are located within the City of Toronto. However, the legislation affects all communities in the province by making it illegal for any municipality to apply for a federal exemption or the renewal of a federal exemption for the purposes of operating a safe consumption site without the approval of the provincial health minister. This effectively bars any new sites from opening, regardless of the need in that community. Applications for new sites in Barrie and Orillia have gone unaddressed by the province. The Barrie application was dropped after waiting nearly 3 years for provincial approval. Moreover, since federal exemptions are only valid for 3 years, a ban on seeking a renewal of an exemption has the potential to close all supervised consumption sites in the province within the next 3 years. This represents a step backward for all communities in Ontario.
Thank you, John, and thank you to all the committee members here with me today. We hope that this video, together with the other resources we have gathered, is helpful to you and your parish in considering this year's motion. As John has already alluded to, given the scale of the overdose crisis in our province, it is likely that members of your parish, clergy and lay people alike, will have been touched by the overdose death of someone dear to them, whether that's a family member, a friend, or someone in the community. While this may be a controversial topic, it also calls us all the more to be compassionate as followers of Jesus. Some people say, are we required to pass the motion? Do we have to pass it as written? No parish is required to pass the motion. As the old saying has it, all may, none must, some should. Whatever you choose to do, please communicate the result to us, either by email or by ticking the appropriate box on the incumbent's return. If you do pass the motion and make any changes to the wording of it, please send us a copy of what is passed. You can email me at egolden, EGOULDEN, @toronto.anglican.ca. Your responses help us. They help myself, the committee, and our bishops as we bring up these issues with elected officials in our diocese. And our advocacy on issues like these helps encourage members of other faith communities and denominations to speak out as well. You can look for a follow-up on the results of this year's motion on our website and in the Anglican later this spring.